Hi, so day 16 of my total joint replacement and discectomy in my TMJ, answering some questions. Questions I've had asked. How did I deal with the pain and the swelling in the first few days? I was in ICU for 24 hours and I was heavily pain medicated. I don't really remember much. I remember being quite silly to my mum and my sister. But yeah, the pain was managed there, and then they took me to the ward where they continued to manage it, and they stayed on top of it. Nurses, if I felt pain, nurses were onto it. You just had to ask. I personally had a little buzzer that gave me pain medication if I needed it. So I asked for that, and that was really convenient, so I didn't have to continuously ask nurses for the first couple of days. Swelling, I definitely, they gave me like their own little, they gave me their own little wrap that like a sock that they had put ice packs in, and I had to tie it up over my face, and it was pretty useless. I didn't start using my ice packs until I got home, which is why I'm pretty adamant that you need to take those into hospital with you. They have been a lifesaver and my number one thing. So my swelling was managed by their little sock with a ice pack in it. But it was still pretty bad, and I'm open to showing you photos of how swollen I was. I just would like you to, if you would like to see that. Okay, the next was, did it feel strange to talk and chew, and does it? Yes, because my bite has completely changed, but for the better. So my bite has moved. My teeth are aligning for the first time, which is amazing. And means only a few teeth are touched. So I am going to need some dental work done to build my teeth up from grinding them in and clenching prior to my surgery. But that is so, I'll take that as a win. And last of all, oh, does it to talk? Yeah, I can only talk with my mouth very limited. As you can see, and chew, I have to still on a soft chew diet, so I still use just letting it melt. Last one I will answer in the next video.